Alex Kopelowicz is an associate professor in the Department of Psychiatry at UCLA School of Medicine. He's the medical director of the San Fernando Mental Health Center. He's the chief of psychiatry at Olive View UCLA Medical Center and president of the Latino Behavioral Health Institute. Wow. Dr. Kopelowicz's work reflects a commitment to carrying out research that has application in practice to improve the daily lives of people with serious mental illness. It's my privilege right now, really, to introduce someone who's very special. He is our special guest speaker, Dr. Alex Kopelowicz.
Thanks again. I'm very, very honored to be here. I'm so delighted with the turnout for this first Recovery in Action fundraiser. I wish Chris and his group the best success for this extraordinarily important project that they're doing. You know, Chris and Charo came to see me a few months ago to talk about Recovery in Action, and I was just thrilled with the possibility of what could happen with this organization. And he had actually asked me in our meeting if he could present it at the hospital, Olive View UCLA Medical Center, in a grand rounds. And I was delighted at the opportunity of offering him a chance to speak to our physicians, our social workers, our psychologists, and the nurses, the entire department. And it was a wonderfully inspiring talk that he provided, and really the staff are still talking about the job that he did and with his group of people that came to talk about the work that they're doing. And the reason it particularly was important to me to have Chris speak was, you know, the truth is I reflected on my own training as an undergraduate, as a medical student, and as a psychiatrist in residency, how little I learned about the whole notion of recovery and the importance of focusing on what is hope and what is possible for people with serious and persistent mental disorders. And I remembered how fortunate I was in a way, and it's going to sound kind of odd, but my reasons for why I've been so interested in this area has to do nothing to do with my training or my formal training. It has to do with my own personal experience, completely and utterly to do with that, because as a young man, actually as a teenager, my best friend growing up developed a psychotic disorder. And I was 15 years old. I still remember it. It was Labor Day weekend, 1977. We went to the Grateful Dead concert in Englishtown, New Jersey. For those of you who can still remember 1977, I made it home in one piece, and my friend, unfortunately, although he had not used any substances, believe it or not, actually was hospitalized because he had begun to hear voices and had paranoid delusions, etc. In any event, he was my best friend at the time, got diagnosed with serious and persistent mental disorders, was one of the lucky few that responded well to medication, so well as a matter of fact, and this is interesting, and many of you in this audience will understand this and sympathize, he did so well and was able to recover that the physicians at the time, this is again in the late 1970s, early 1980s, didn't believe that he had a serious and persistent mental disorder and took him off his medication. And consequently, you're not too surprised to find out he had yet another episode. Well, this went on actually for 3 separate episodes from age 15, 16 to about 22, where he would do well, get on medication, do well, be taken off medication because he couldn't possibly be seriously mentally ill because he was doing so well, and the cycle just kept continuing until finally, unfortunately, he met his future wife. And his future wife told him that no matter what any doctor says, if he gets off of his medications, she's going to leave him. And that was it. She actually convinced him that he needed to stay on his medications, and he's been on them for now 25 years. He's married to that same wonderful woman, has 2 children, one of whom just started college. He works full-time, does the kind of things that Dr. Camilleri was talking about. In any event, the point of my story, besides the fact that he's a dear, dear friend, and I speak with him at least twice a week and have for the last few years, is he's really what taught me about recovery from mental illness. Not anything I learned in a book, not anything I learned in a class. It really started from my own personal experience, and that's why I meant being lucky to have had that experience. He was really my first connection with mental illness. And when I first decided to become a psychiatrist and go to work in that field, I started thinking about how to really make that point or understand more about recovery. And so I know it's going to sound pretty odd, but even as a medical student, I started reading the literature in psychiatry about recovery, and I discovered the work of Courtney Harding at Yale, and actually sought her out at one point to talk to her about her findings regarding long-term recovery. And then my wife, who's here with me today, will remember that on our honeymoon, we were traveling through France, and we made a side trip to Bern, Switzerland. And I didn't really tell her why I wanted to go to Bern, Switzerland, otherwise it was a beautiful place, but it was also where a psychiatrist named Luc Ciampi had been practicing, and I had wanted to meet Dr. Ciampi because he had been writing about recovery since the 1970s, and I had an audience with him and got to talk to him about this. And so I was always very fascinated with the notion of people getting so much better, because we did not learn that in our rotations in medical school or even in residency training. I remember training at a tertiary state hospital where, believe me, no clinician was going to talk about recovery. That wasn't really the focus. But instead, I had the good fortune to seek out mentors who were interested in this area, and one of them is actually here tonight, Dan Dorman, who was in my, when I was a resident, I had sought out for supervision because of his attitude towards recovery from serious and persistent mental illness. And so I was able to seek out people who believed in that sort of vision and really nurtured that perspective in me. As I got out of my residency, I started working with another gentleman, leader in the field, Dr. Robert Liberman, who also mentored me towards this process of thinking through recovery and really how to operationalize what recovery is all about. Because as I was talking to Dan Fisher a little earlier, so often the notions of recovery really are bottom up. They start from the grassroots and reach up to get to the academic worlds. And so what I was hoping to do in my earlier part of my career was to kind of develop a language so that academicians could also begin to study the whole process of recovery and therefore be able to validate it from the academic perspective as opposed to the grassroots perspective that had already understood it so well. So that's been my challenge, and for my career over the last 15 years or so, is to try to get folks to believe in this notion of recovery so that we can study it, so we can understand it, so we can actually bring it to a point and try to obviously facilitate that process in some sort of a clinical research way that will then be able to be propagated, and so that it becomes something that is understood not just by those of us here in the audience who have seen it, who believe in it, but those of us in the academic world who are the movers and shakers, and who can get research funding associated with it. And that's really the piece that I think is the next part. I mean, as far as the notion of where the science related to psychiatry is going in terms of genetic studies and neuroimaging studies, all of those are very, very important. But I think that if we also overlay on that the notions of hope, the notions of expectation, the notions of work recovery, social recovery, and put those together with the genetic pieces and the neuroimaging pieces, then I think that we have a science of recovery that will be able to move the field forward and really start, not just in terms of using the lingo, but actually being serious about understanding how this process is happening and how we could actually facilitate that for our patients. So when Chris came to me, and that's how I'm coming full circle about doing a grand rounds at all of you, as far as I was concerned, this is long overdue. And it's really something that has to permeate in our training at the undergraduate level, at the medical school level, and at the psychiatric residency level. And of course, if we can facilitate that process, I think the rest will follow. So I want to thank, again, Chris for inviting me here tonight, and thank you all for supporting his efforts. I think it's a fantastic effort, and I want to applaud you, Chris, and your organization for all the fantastic work you're doing and what you're going to be doing in the future. Thank you very much.